Okay. Well, it's really it's a real pleasure and an honour to be invited here. And when you look at me, of course, you'd never realise that I spent 30 years in the police with a blue suit and the polished shoes, and Mark has polished shoes. But let me just give you a little background as to why I'm standing here after over 30 years policing and retired 10 years now, saying that drug prohibition is bad for policing and that we must end drug prohibition, because it certainly seems counterintuitive given my background, but maybe not. I was born into a comfortable middle-class family in Oxford. I was lucky enough to get a place at Oxford University before you had to get 6 or 7 A stars. I read philosophy and psychology, which kind of equips you for nothing in particular, but maybe, perhaps, almost everything in general. I decided to join the police, and I'm not quite sure why, but I used to supplement my grant. We had a grant in those days rather than a loan. I am part of the lucky generation in that regard. I used to work on building sites, and it was something about mixing with people that I didn't normally encounter that somehow made me think I wanted to do something which was around helping people. And I decided to join the police with a motivation to help people and catch criminals. What that did was expose me to the horrible underbelly of human behaviour, human tragedy, the violence, the poverty, the real sadness and misery that is a part of so many people's lives. And as I reflected on that, I mean, for example, in the early 70s, before we really had a heroin epidemic, young men and women were collapsing in Piccadilly Circus and around that area, overdosing, and they were brought into the hospital and thrown into a room which was called the pit. So these were human beings, and yet they were being dealt with in this really callous way, as some sort of rubbish to be swept up, and that didn't quite fit with my sense of the way the world should operate. And there were many other examples as I focused on my career, playing my part in arresting people either for possessing drugs. There's one young man I remember, innocent bloke, but I was doing my job, this is what you did. He got a cannabis conviction, and certainly that would have limited his life chances substantially. I'm talking here about the UK, but I spent, in the last 10 years, I've been lucky enough to go to North America, to South America, to the Far East, to Europe, and this is a characteristic of drug prohibition throughout the world. So I'm not just talking about the UK and my policing experience, but more broadly, and I've obviously read widely, but I think it gives me some legitimacy in coming here to Guernsey. I'm not going to say this is how to do things, but I believe there are ways of challenging what you're doing, and that is at the heart of the Dandelion Project. And maybe my degree in philosophy certainly helped me to think, don't just accept what's in front of you, think about a different way of approaching things. So as I said, this experience of policing, and as I went up the organisation, eventually becoming the most senior rank you can achieve, it became clearer and clearer to me that we were doing things wrong and things had to change. But it was also incredibly frustrating because it was very difficult to get people to engage, and certainly not politicians. So this is by no means an easy task when you think that I've got less than 18 minutes to challenge 45 years of this failed policy. And it's not just the policy, but it's the psychology. Drug policy and drug taking is a very emotional issue because everybody starts thinking about their children or the friend they knew or David, who suffered, I think, under the prohibition regime. And they think, well, really, this is so difficult, maybe we shouldn't change it. We shouldn't change anything because it'll be too risky. And it's very deeply embedded in us as a sort of a policy area, unlike other policies like sort of transport and education we've been talking about. I think this one strikes a bit more deeply. And so I really don't underestimate the challenge. But it is a challenge we must face, otherwise we will simply continue with this failed policy which is damaging so many people's lives. Okay, I've come to the conclusion that drug prohibition is a hugely costly, counterproductive and harmful failure. Now, it's hugely costly. Probably in the UK, we're spending more than 10 billion a year on drug law enforcement. I don't know what the sums are in Guernsey, but no doubt they will be a substantial part of the law enforcement budget, and not just the police, but the prison system and the border controls, customs and the like. Around the world, maybe $100 billion a year is spent on drug law enforcement. This is a huge cost. And it's a cost which just in itself is a huge amount of money. But when you put it against the fact that it's supporting a failed policy, it just actually becomes crazy, it becomes irrational, it becomes indefensible. This is a failure because the stated aims is to reduce the production, supply and consumption of drugs. And what we've seen since Nixon, President Nixon in 1971, probably almost certainly for racist motives, declared drugs public enemy number one for political ends. We have seen trillions spent on trying to combat a market which has grown inexorably to perhaps being worth $500 billion every year. And that is a trade that is run by criminals. It's hugely costly in terms of policing, and why it's bad for policing, because think of the effort that goes into arresting and charging somebody for having 0.04 of a gram of cannabis, and then maybe sentencing them to a term in imprisonment. You might think that's ridiculous. Well, that's what I read in the Guernsey press on the flight over here. That is what your taxes are being spent on, so that your police are locking people up for tiny bits of cannabis, which everybody knows, if you look at the evidence, is safer, far safer than alcohol. And so it just offends a sense of rationality when you've got. Okay, I'm going to use a little bit of Latin here, harking back to my education, because there are proper real crimes and there are other types of crimes. And I think it's important when you start engaging in the debate, when people say, well, if you sort of legalize all drugs, it'd be like giving burglars television sets. No, different sorts of offences. Malum in se, evil in itself, assault, theft, murder. These are just evil of themselves. You don't need a justification for having a law against them. But what about something like religious observance, or homosexuality, or for that matter, drug taking? These are simply defined as being evil. Malum prohibitum. We have seen the light in the UK and elsewhere in relation to not locking up homosexuals and people who want to observe a different God or a different way of achieving spiritual enlightenment. But we haven't with drugs, where somebody is simply taking something either because it makes them feel good, or for spiritual or educational or recreational purposes, or for that matter, and this is a huge issue when it comes to drug taking, people suffering sexual, physical, emotional abuse as children, blot the pain out with drugs. If you've got a problem with drugs, the last thing you need is to be arrested and prosecuted. And if you haven't got a problem with drugs, the last thing you need is to be arrested and prosecuted. And when I think about, and David, I hope you don't mind me referring to you, but I did more harm than good as a police officer, and I think every police officer when it comes to drug law enforcement is the same. You needed support, not punishment, as a 12-year-old taking drugs. But you knew it was illegal to do that. You had to get into the underworld. We have, and this is the counterproductive element of our failure in this policy, we have gifted this massive market to criminals because we have raised the price by denying access to something that people want. And that's standard economics. So there is a massive incentive. Don't let me hear you say, oh, well, you know, if we change things, if we get rid of prohibition, what about the children? Your children have no problem getting drugs because there are people out there making a shed load of money, only too happy to give it to them. They don't care how young they are. They don't look for a passport. They look for the £20 note. And that'll score them their heroin, that'll score them their speedball, their cannabis. In Uruguay, for example, a much more enlightened country, and strangely enough, a small country, only 3.5 million people, they have now legalized access to cannabis. And their motivation was to separate their children from the dealers in something called base paste, which is a cocaine product. They wanted actually to separate the markets. They were actually thinking of the children and the health of the nation as a whole by moving towards a solution which is based on evidence and rationality rather than on, and it's interesting, I pick up on what other people have said, on belief rather than values. And if you want to destroy hygge, prohibit drugs, and you will set up all the circumstances which make the police waste their time on persecuting people when it causes them more harm than good. It encourages racism. It's quite clear that the evidence in the UK elsewhere is that there's a racist element and that drug prohibition actually gives a tool to law enforcement to depress and to overcome, if you like, fight against sections of community that seem to be undesirable. The United States has 5% of the world's population. It has 25% of the world's prisoners. And that has grown absolutely from the 70s, absolutely mirroring almost the spend on drug law enforcement. Now, I know there's a big concern. If we go to the solution I advocate, which is legal regulation by government of all substances that human beings consume, so you've got medicines, you've got what are called drugs, you've got alcohol, you've got food and drink. We know you can read the packet, you can read the contents. Nobody needs to die of an overdose, as they do in their thousands in the UK and around the world, if you had proper packaging. So if we had that control and regulation, would you see a huge increase in drug consumption? Two answers. One, no. Pretty much saturated already. Two, would it be actually worse if people, not mixing it with tobacco, consumed cannabis to relax, consumed MDMA ecstasy to relax, rather than consuming alcohol with its extremely harmful effects? Now, I did say at the beginning that I was going to talk about why this is bad for policing, and I think I've given you an idea that there's a huge waste. But the really sad thing is that we talk about a war on drugs. You can't have a war on drugs. You can't have a war on tables. It doesn't make any sense. But drugs are inanimate objects. We've made the mistake of vilifying drugs. Drugs are evil. They're not evil. They can't be evil. What's evil is persecuting people who find themselves in difficulties as a result of their problematic drug abuse. So we are faced with a challenge, which is to understand that this is a war against people. And we and you charge your police officers with waging this war. And that is completely counterintuitive to what they should be doing. They should be supporting and not punishing. And it's within, I believe, the grasp of a community like Guernsey to exercise discretion and to engage with law enforcement officials. Any here? That's a bit of a silence. Do I get that silence added onto my 18 minutes? Why not? I just want to talk to people. I'm not going to convince people overnight to give up everything they've done, but I've done it. I think policing is a really worthwhile profession. I admire police officers. Police officers die in the course of drug law enforcement. Look, I took the liberty of writing a letter, and this is a letter from a chief of police. Doesn't matter where it is, you can make your own minds up. And it is addressed to all of the staff of the police organisation. And it says, "You'll be aware that I've made it clear that we should change the way we tackle the harms caused by drugs and the criminal markets that supply them. May I make two things clear now? This is the chief officer speaking. I'm not in favour of people harming themselves by taking substances, whether illegally or not. But I remain convinced we must change our approach. And part of that approach will be setting new objectives for us. We will no longer regard simply arrests and seizures as a measure of success, but much more reducing harm, perhaps referrals to treatment and the like. And I can expand on this afterwards. I'm here until Wednesday lunchtime. So, police officer, before using the criminal law to deal with a drug user, ask yourself these questions. Will this help the person I'm dealing with to improve their life? You're addicted to heroin, and I'm going to throw you in prison? Maybe not. Will this help improve the lives of their families and friends? Will this help improve the neighbourhood I police? By the way, I'm one of those people who writes a blog on the internet that nobody reads. Well, a lot of us are like that. Mark, yours is read by everybody, of course. But will this help improve the this you'll find this there, Tom C. Lloyd, WordPress. Will this help to improve the neighbourhood I police? Will it reduce crime in the longer term? Will it help reduce criminal profits from drug dealing? If the answer is no, well then why are you doing it? And that's a challenge. Why are you doing it if it's not actually doing some good? There's key reasons for change. Not all drug users are the same. Some drugs are more harmful than others, and we should vary our approach accordingly. All drugs are more dangerous when their production and supply is in the hands of criminals. Some use less harmful drugs moderately, with minimal, if any, harm caused. 90% of people without a problem. Similar to moderate drinking. A criminal record is likely to cause them more harm than good. And I know I spoke to somebody whose son spent time in prison for possession of cannabis. It's just a crying shame. Some use drugs, often cannabis, to reduce the pain and suffering associated with conditions such as MS and Crohn's disease. Most problematic drug users are dealing with traumatic incidents in their lives. They need our support, not punishment. Many low-level drug dealers are themselves problematic drug users. And some are also prolific offenders. We should actively seek them out, not wait until they commit a crime, and offer support and treatment to help them change their lives and reduce crime in the long term. I have some experience of doing that in a previous life. Sometimes so-called druggies present a horrible front, and they do horrible things, and they rob from their grandmothers. How many people at the age of 10 decided that they want to be a problematic drug addict by the time they're 25? None. So let's think of them as somebody's brother, sister, mother, father. It costs less to treat a user than to deal with the consequences of the crime. 70% of acquisitive crime to feed drug habits, that's a burden on police, which is a complete waste. Okay, I've just got half a minute left. You can tell I think strongly about this. I'm lucky it hasn't happened to me. I have one alcoholic brother, it's the same. He was lucky because drinking alcohol is not a crime. Just think of the thousands, if not millions out there that you could positively impact. If you could say to your police service, and they serve you, we don't want you to do this anymore. We want you to think of doing it in a different way. So if you have been, thanks for listening.